Aspergillus clavatus causes Maltworker's lung, a type of EAA. Extrinsic allergic alveolitis, EAA, also known as hypersensitivity pneumonitis. Lung volume reduction surgery can be used in the treatment of alpha-1 antitrypsin deficiency. Serial peak flow measurements at work and at home are used to detect occupational asthma. Measles is characterized by prodromal symptoms, Koplik spots, maculopapular rash starting behind the ears and conjunctivitis. Symptom control in non-CF bronchiectasis, inspiratory muscle training plus postural drainage. A normal PCO2 in a patient with acute severe asthma is an indicator that the attack may classify be life-threatening. You're absolutely right that a normal PCO, partial pressure of carbon dioxide, in acute severe asthma can indicate a life-threatening situation. This happens because in severe asthma, patients initially hyperventilate due to airway narrowing, which lowers PCO. If the PCO normalizes during a severe attack, it suggests that the patient's respiratory muscles are tiring, and their ventilation is failing, a dangerous sign. NICE only recommend giving oral antibiotics in an acute exacerbation of COPD in the presence of purulent sputum or clinical signs of pneumonia. Macrolides such as clarithromycin are used to treat Legionella. The most common causes of viral meningitis in adults are enteroviruses. Legionella pneumophilia is best diagnosed by the urinary antigen test. Bronchiectasis, most common organism equals Haemophilus influenzae. Isocyanates are the most common cause of occupational asthma. COPD secondary pneumothorax is the most common cause of pneumothorax management. The high-risk characteristics that determine the need for a chest drain are hemodynamic compromise, suggesting a tension pneumothorax, significant hypoxia, bilateral pneumothorax, underlying lung disease, greater than or equal to 50 years of age with significant smoking history, hemothorax. Basal atelectasis should be suspected in the presentation of dyspnea and hypoxemia 72 hours postoperatively. Oxygen dissociation curve. Shifts left, lower oxygen delivery, lower acidity, temp, 2 to 3 dpg, also HbF, carboxy methemoglobin. Shifts right, raised oxygen delivery, raised acidity, temp, 2 to 3 dpg. Extrinsic allergic alveolitis is associated with upper mid-zone lung fibrosis. Pulmonary hemorrhage may be associated with a raised transfer factor for carbon monoxide. Magnesium sulfate, monitor reflexes plus respiratory rate. The majority of patients with sarcoidosis get better without treatment. Chronic infection with Burkholderia cepacia is an important CF-specific contraindication to lung transplantation. Contraindications to lung cancer surgery include SVC obstruction, FEV less than 1.5, malignant pleural effusion, and vocal cord paralysis. NIV should be considered in all patients with an acute exacerbation of COPD in whom a respiratory acidosis, PaCO2, 6 kPa, pH less than 7.35 greater than or equal to 7.26 persists despite immediate maximum standard medical treatment. Patients with WAT variants can develop secondary polycythemia and hence have an increased risk of thrombotic events. High oxygen affinity hemoglobin. Patients with a secondary spontaneous pneumothorax that is managed conservatively should be monitored as an inpatient. Paraneoplastic features of lung cancer. Squamous cell, PTHRP, clubbing, HPOA. Small cell, ADH, ACTH, Lambert-Eaton syndrome. Painful shin rash plus cough, sarcoidosis. Pleural effusion, malignancy is associated with an exudate. Small cell lung carcinoma secreting ACTH can cause Cushing syndrome. Minimally symptomatic pneumothorax, regardless of size, can be treated with conservative treatment or regular follow-up. Asbestosis causes pulmonary fibrosis predominantly affecting the lower zones. Pleural plaques are benign and do not undergo malignant change. They, therefore, don't require any follow-up. COPD, still breathless despite using SABA, and no asthma steroid responsive features add a LABA plus LAMA. The most common organism causing infective exacerbations of COPD is Haemophilus influenzae. Bacterial vaginosis, overgrowth of predominantly Gardnerella vaginalis. Transfer factor. Raised, asthma, hemorrhage, left to right shunts, polycythemia. Low, everything else. Sleep apnea causes include obesity and macroglossia. Listeria monocytogenes, gram-positive rod. Polysomnography is diagnostic for what obstructive sleep apnea. Alpha-1 antitrypsin, PIMZ equals carrier and unlikely to develop emphysema if a non-smoker. COPD, still breathless despite using SABA, and asthma steroid responsive features add a LABA plus ICS. Terbinafine inhibits the fungal enzyme squalene epoxidase, causing cellular death. Hypercalcemia coupled with bilateral hilar lymphadenopathy suggests the diagnosis of sarcoidosis. Consider granulomatosis with polyangiitis in patients with ENT, respiratory, and kidney symptoms. The valency of a vaccine denotes the number of distinct antigenic components or serotypes a vaccine can protect against. Vital capacity, 4,500 milliliters in males, 3,500 mls in females. Visceral leishmaniasis, sodium stibogluconate is the recommended treatment of choice. Formoterol is long-acting beta agonists, LABAs. Maintenance and reliever therapy MART. Asthma, adults and children greater than or equal to 12 years second-line treatment low-dose inhaled corticosteroid, ICS, formoterol combination inhaler regularly and as required, MART. For adults and children aged 12 years and older with asthma, a recommended second-line treatment is the regular use of a low-dose inhaled corticosteroid, ICS, combined with formoterol in an inhaler, both regularly and as needed, MART. CVS. Ventricular arrhythmia is the most common cause of death in patients with hypertrophic obstructive cardiomyopathy. Persistent ST elevation following recent MI, no chest pain, left ventricular aneurysm. Gallop rhythm, S3, is an early sign of LVEF. Patients with heart failure with reduced LVEF should be given a beta blocker and an ACE inhibitor as first-line treatment.